Hi, everyone. I'd like to welcome you to another Form Assembly webinar. Thanks for joining us today. Today, we're going to be talking about facing change in healthcare. So it's no secret that the ongoing and constantly changing pandemic has affected healthcare and many industries in a number of ways. So today, we wanted to take some time to share how it has affected specifically the areas of security, compliance, and workplace norms. As a HIPAA compliant web form platform, we like to remain up to date on the most current news in HIPAA compliance and data privacy for healthcare. So that's our aim, is to share some of the most up-to-date information with you so you can be better prepared to weather these challenges. I'm joined today by Chad Craigle, who's our Information Security Officer, and he's got a lot of great knowledge on data privacy in healthcare and beyond. Chad, thank you so much for joining me.
Hey Maggie, thanks for having me on.
Awesome. Really excited to jump into this topic. Before we get into it, I want to give a quick overview of form assembly. This is something we do at the beginning of all our webinars, just to give you some context for who we are and what we do. Form assembly is essentially an all-in-one web form building and data collection platform. It starts with an easy-to-use form builder. It's drag and drop. Anyone with even limited technical knowledge can use it to build forms. We offer a number of robust integrations with Salesforce and other systems that you may already use. And we also have high security and compliance standards. And we'll talk a little bit more about that today. But most notably, our Compliance Cloud plan is HIPAA compliant and also GLBA compliant. And all form assembly plans are PCI DSS Level 1 certified and offer encryption at rest. So through all of that, companies are able to save time, money, and effort in all of their day-to-day processes and get the most out of the data they collect, whether that's information on new patient forms, whether it's research surveys, contact forms, whatever that might be. And with that, we're going to move into the presentation. Like I mentioned, we're talking today about facing change in the healthcare industry. We're going to focus on shifts in HIPAA compliance that are related to the coronavirus pandemic, new and heightened security threats, and then the growth of telehealth and remote work, which is a trend that has touched numerous industries, including healthcare. And with that, I'm going to turn it over to Chad to talk about some of the most recent changes in HIPAA compliance.
Yeah, so there's been a couple shifts in HIPAA over the last few months now, and one of them being telehealth. Telehealth is where it gave healthcare providers the chance to work from home. This was mainly due to reduce face-to-face contact. Also, first responders, this allowed first responders to share information for certain situations. Also, there was a change to the privacy rule waiver. This was around the sanctions and penalties around HIPAA. Also, emergency guidance bulletin. This allowed information to be disclosed to family and friends. The bulletin also covered entities to disclose necessary PHI without authorization. Here are some of the key HIPAA-related changes. First responders. If an individual is or has been infected with COVID, the first responder can share that information, but only in certain situations. When the disclosure is needed to provide treatment, when the state law requires reporting or confirmed of suspected cases, or to notify public health authority. Also, telehealth platforms. This rule was in place and stated that telehealth services must use non-public facing audio and video telecommunication technologies with patents. This included Apple FaceTime, Facebook Messenger, video chat, Google Hangouts, and Skype. However, providers should not be using public facing telecommunications such as Facebook Live, Twitch, or TikTok. To communicate with patients, as communications on these social media platforms are not private and shared widely. During this time, there was a Zoom vulnerability where anybody could join anybody's call. So this is why they were trying to limit which services could be and could not be used. Let's talk about the good faith breach. So a good faith breach, meaning providers should act in good faith and not bad faith. So bad faith would be a provider selling patient data to obtain, their personal health records. However, if a breach occurred, the healthcare provider acted in good faith, then the good faith breach would come into play. So this rule simply means that if somebody was doing their job in good faith and data got stolen, the good faith breach rule would come into effect and the person would not be held accountable. But we do need to remember, before this rule, if a breach occurred in good faith, the organization still would be held accountable. So in my opinion, this is a very big change. It'll be interesting to see how it all works out. So we have fewer rules than we used to, so only break them to extend what you need. This essentially means if you are using a not approved telehealth way to communicate because the patient lacks resources, it would be okay. Or writing down a social security number because you need to further investigate something, you could have some leeway there. Or using speakerphone because of some technical issues, you could get away with that as well. I think acting in good faith goes a long way here. Yeah, HIPAA compliance is key. So doing the right things and following HIPAA guidelines, no matter your location or activity, is very important. Just because waivers mandates have been established to more lenient does not mean you get those privileges. You should always take due care when it comes to your patients. You gained a trust with them, and so it's important to keep that trust. Some best practices moving forward is to move away from traditional disaster recovery and business continuity plans. Traditionally, disaster recovery audited to ensure all systems can operate in their best and where to put employees if a disaster were to occur. Well, in today's world, we didn't really need that methodology. We needed it more. How can we get people to work from home in a safe and secure manner? Not many people ever expected or predicted to see this much home workforce, but here at Form Assembly, we're an all remote company, so we didn't have to transition. So we got lucky, but many companies scrambled to make it work. With that being said, once this all goes away, it would be a good time to evaluate how things have gone differently and think about how you and your organization can protect data better if this ever happens again.
Thanks for that, Chad. Yeah, I think that's an important point to drive home that, some of these waivers we're talking about may be temporary and have been enacted because of the ongoing crisis, but things may change in the future. So it's important to keep proper HIPAA compliance best practices in mind. And with that, we're going to move on to another category of change that has arisen, and that's security threats. This is something Chad has a lot of firsthand information on, so I will pass it over to him to talk about some of the change in this area.
Yeah, so some of the heightened security threats for healthcare, they've been on the rise. If you think about it, when you're at your office building and a network is attacked by a threat vector, you have a security team to help detect and mitigate those risks. However, working from home has allowed many users to use their personal devices, which could be running outdated software and system updates, which leave you very vulnerable. Home Wi-Fi networks might be using weak encryption, and you might be logging into websites you shouldn't be because your web content filter isn't working as it only would work when you're on an office network. So threat actors know these things, so they try to exploit you and these vulnerabilities. So it's really important to keep things up to date and current, and this will help mitigate any of these risks. So as you can see, for example, Google removed 18 million phishing campaigns in one day that were related to COVID. And that's on top of the 240 million scams they receive a day. So it's extremely important to practice the same security best practices no matter where you're working from. Thinking about the 18 million COVID scams in one day makes security awareness and phishing simulations a must for organizations. It only takes one click for an entire company to fall to its knees. Training can be tailored to all the major security concerns, and phishing simulators can be used so end users can see what a real COVID-19 phishing email could look like. They come in many different shapes and forms, but some of them have very real characteristics and entice the user to click on it. Another way to combat account compromise is using multi-factor authentication, or MFA. Companies like Duo and Google Auth and YubiKey provide a second factor of authentication. So instead of just a username and password, you get a username, password, and a code. If your password has been taken or has been compromised in a breach, the threat actor would need the code as well. So that could be sent to your phone, and then you would put that input into the validation. It's really important If you see something, you need to say something. Employees should be encouraged to report anything they see as bad, even if the user caused the issue. For example, if someone clicked on a phishing email, it should still be reported as quickly as possible so an investigation can be underway. Because at the end of the day, we're all humans and mistakes happen. Data should only be sent in a secure manner, such as using TLS 1.2 for data in transit and using an industry standard for encryption at rest like AES 256 or FIPS, which is a federal standard. Using form assembly compliance code offering is highly encouraged if you're collecting PHI or other HIPAA data. Data is secured and backed up to meet all of your compliance needs. So some of the best practices, this comes from our security team within Form Assembly. So we are hosted in AWS, which gives us full control of our environment. We're able to put the best practices in place and monitor them in real time. We conduct monthly security awareness training and phishing simulations for all users. We also do encryption in transit and at rest. All of our policies and procedures are completely mapped to NIST 853. Our incident response plan is reviewed and tested annually. We have backups and snapshots that are continually throughout the day. We are performing disaster recovery and business continuity testing throughout the year as well. And any and all access is based on least privilege or need to know. These are just some of the security protocols that we are following. And if you want more information, you can hop over to our website.
Thanks, Chad. And now we're going to transition into the last portion of our webinar here on change. And we're going to focus on changes in the workplace. Remote work is a growing trend in multiple industries, and healthcare is no exception. Chad alluded a little bit to the growth of telehealth previously, and so we're going to focus on that because that is a significant change that already has and may in the future affect healthcare. So Chad, take it away.
Yeah, so there are new remote trends in healthcare. It's interesting to see. And as I mentioned earlier, many of the healthcare workers had to work from home. So it's really suggested to reevaluate the controls that an organization may have in place so you can discuss the difficulties found during that at work home time so that you and your organization can improve the process for the future. You know, we hope nothing happens like this again, but we didn't expect this either. So as we said, make sure you're updating your policies and procedures to respect the disaster recovery and business continuity plans. Also, right now, the office and work from home life is much different. You're now able to see your family more, you have dinner together, and you see everyone morning and night. If the remote work continues after the pandemic, it's highly encouraged to find an IT security consulting firm to audit and help secure your remote work lifestyle. If you need help with this, you can reach out and I can help you find a few firms to fit your needs. So some of the benefits of the remote work life, Form Assembly is a remote company first, so we all reap the benefits of this lifestyle. However, we are very proactive security department, so we ensure that the right measures are in place, and so we encourage you to do the same. Here's some benefits that I heard firsthand. My wife is in healthcare, and she was mentioning that her patients think it's a lot easier to do telehealth because some of them travel a long distance, and it cuts their day way down. So, you know, that's a major thing. Productivity can be better working from home. If a call ends or you get 15 minutes of free time, you can take the time to empty the dishwasher, process a load of laundry, or pay some lingering bills. I do know that a majority of the Form Assembly team focuses on physical and mental health throughout the day. So running and yoga and taking maybe a quick cat nap to regenerate are very possible. So how do you prepare for the shift? Well, keeping up with technology is probably the biggest. So ensuring that all of your equipment is up to date, using a robust antivirus that enables signatures to be updated, having your firewall turned on, and encrypting your home device could save you from a data loss. You should also make sure that the right personnel is in place and if you're staffed accordingly. Our help desk support remotely troubleshoots issues, but we've given that person the right tools to get that job done. Remember, when you leave the office, you should take those security measures with you. You should treat your home security as if you were at the office and being mandated to follow those rules and procedures.
Thank you, Chad. And with that, that concludes most of our presentation for today. We hope this helps you face some of this ongoing change. And we're aware that this is really just the tip of the iceberg and information that we have gained through our research, but we're always ready to help more if you want to reach out and get any insight into healthcare data collection, data privacy. Just to wrap things up before we move on to the question portion, I want to give everyone a little bit of information about our COVID-19 assistance program. We developed this program to help those serving on the front lines against the spread of coronavirus. And within this program, we offer free compliance cloud accounts and implementation services to organizations with projects that are involved in that fight against COVID-19. You can use our platform for a number of use cases that are, related to coronavirus, from self-assessment questionnaires, epidemiological studies, clinical trial screening, volunteer registration, donations. The list really goes on and on, but essentially we want to do what we can as a form building platform to assist those who are working on these very valuable and very pivotal projects. So with that, I invite you, if this applies to you in your organization, or if you know someone who this applies to, please visit us at formassembly.com/coronavirus-assistance. And we can send this link out in the recap email for this webinar as well. And so with all of that, we'd love to invite you to ask any questions that you might have had during this presentation, anything about form assembly, anything about healthcare data collection. Let us know, and we will answer as many as we can right now. All right, just to launch us off into the Q&A, we are going to cover a few frequently asked questions. And Chad, I'm going to turn over to you for some of these. Since we did focus on healthcare here, I'd love it if you could just give me a quick overview of form assembly for healthcare. We kind of alluded to that a little bit in the webinar, but some people might be interested in how form assembly is used for healthcare and some of the benefits there.
Yeah, sure. So the way that we're able to do this is we do follow HIPAA mandates. And in our one offering, which is our compliance cloud offering, we're audited by HIPAA, but then also that environment's audited by PCI. So we kind of have a dual layer of controls that are being mapped together. And so through the HIPAA offering, we are able to meet your needs for collecting patient data. And so, we have SLAs in place for that, privacy controls, and it goes deeper. We have encryption at rest, encryption in transit. But the nice thing about all of that is we're able to collect this data from a healthcare perspective and kind of leave us to doing the hard security work when offices and medical professionals can stick to what they're good at. So this compliance cloud offering has been built and tailored to really support the need of healthcare professionals. And we really saw this a big uptick once COVID hit, and people were thrilled with that environment. And so, if you have any other more questions about it and what it consists of, we can dive deeper, but that's just an overview.
Thanks, Chad. That's a great way of putting all of that. And then to jump back a little bit to what we covered at the end of the webinar, if you guys have any more questions about the Coronavirus Assistance Program, please feel free to go ahead and drop those in here or visit our website for more information. I'm very excited about it, the program, and the people that we've been able to help. We've got some really neat case studies up on the website, so it's been pretty good so far. So if you or someone needs that kind of assistance, I would urge you to take a look into that program. A few more questions we'll just cover here in the Q&A are, what kind of integrations does Form Assembly have? So this is a common question people have. A lot of people know about our Salesforce integration, but there's a lot of other ones. So I'm going to turn it over to Chad to talk about those for a little bit.
Yeah, so the Salesforce one's probably the biggest one, but we do have PayPal, Stripe, Authorize.net, WordPress, Google Sheets, MailChimp, GoToWebinar, and there's a few others. And so all of these are actually up to compliance as well. So all the audits that we actually do, they're involved in the audits as well. We don't physically go out and speak with them, but we review their policies and procedures and actually pull their compliancy language to make sure that the products we are using for our customers are also compliant. And so a lot of these integrations have to do with payments. And so you could be a healthcare provider that needs to take a copay at the end, and by using one of our connectors, you'd be doing it in a safe and secure manner. There's also MailChimp, which is a way for you to send out emails. But again, this is integrated right into the product, so it's very streamless and not too much effort on your end besides configuring the connector to do exactly what you want.
Awesome. Thanks, Chad. And I got to say, it's really interesting to get kind of the security spin on the answers to all these questions because of your role. I think it's really interesting how that does play a part in just about every area in some way. And so to kind of close it off on that note, we'll end with one more question, unless there are any others that come up in the chat. And that last question is, how secure is my data with form assembly? So Chad, that's kind of a big question, but can you address the security of data with form assembly?
Yeah, sure. So they've always said it's not if, but when something would happen. I don't really like to live by that motto. So we really take security seriously, and we build it. We call it defense in depth, or if you look at it from an onion standpoint, there's multiple layers. And so everybody's data at form assembly has to go through many different protocols and procedures before it ends up in the database. So when you first submit something through the form, your data will be encrypted using TLS 1.2 or higher, which is the transition of the data from the application to our servers. And then through our servers, there's different layers in there that break out different regions through these virtual private clouds. And then also it'll end up in its region where it's in the database, and that's encrypted using the standard of, all right, sorry about that, which the standard is AES 256 for encryption. And so we have a lot of access controls in place too. So everyone's that's going to have access to data, it's based on least privilege or need to know, and that's reviewed annually as an overview, but then every 90 days to catch anything that's misconfigured. And so putting your data with form assembly, it's in good hands. We have a lot of mechanisms in place, and we're pretty proud of it.
Awesome. Thank you, Chad. There's so much good information there. I feel like we could do one entire webinar just on security, or maybe multiple. Well, with that, I'm going to wrap it up here, and thank you everyone for attending today. Just, we'll send out that recap after we close up here in a few days. So you'll get that replay of the video in case you missed anything today. So Chad, thank you so much for co-hosting with me.
Yeah, thank you, and thank you to all the attendees for joining.
All right, thanks everyone. Have a great rest of your day.